Hi, and welcome to AAHPO's American Armenian Health Professional Organization's TV Health program. Today's talk is about diabetes mellitus and growth development abnormalities in children. And our guest is Dr. Levon Agdere, who is board certified in pediatric endocrinology. He is assistant professor at Weill Cornell University Medical College and chief of pediatric endocrinology at New York Methodist Hospital in Brooklyn. Dr. Agdere, welcome to our program.
Thank you. Nice to be here.
We have, in adults, obviously, we have very many people diabetics, type 1 diabetic, type 2 diabetic, we call insulin-dependent, non-insulin-dependent diabetics. I'm sure as an endocrinology in pediatrics, you see a lot of diabetics. Who refers you, the pediatric and diabetic patients, to you?
Usually the pediatricians refer the patients, but at times it's not so unusual to see that the patients, the parents are kind of self-referred and they come with suspicion or one of the family members has diabetes, so they know the signs and symptoms.
What kind of signs and symptoms the kid will develop that parents will be very alert?
Because of the increased blood sugar in the body, there will be increased amount of urination, and the child will be peeing more
excessive
than usual amount. To compensate for this water loss, they will be drinking a lot more, so they will be thirstier than usually. And in younger children, the important part is that they may be even not toilet trained, so their diaper amount and the saturation will be more.
Do they have a weight loss?
Yes, they do, because of this increased water loss, as well as some other discrepancies or changes in their metabolic processes. Yes, they will have significant at times weight loss.
Right. Yes. I had at one time in the past a 16-year-old presenting with significant weight loss, excessive water ingestion, and excessive thirst, and turned out to be that she was in DKA, or what we call Diabetic Ketoacidosis. Let's touch on that a little bit. What is DKA?
DKA stands for Diabetic Ketoacidosis, which is a complication of especially insulin-dependent diabetes, or so-called type 1 diabetes, where the insulin is not sufficient, and again, body's metabolic process switches from using the sugar to using the fat tissue and protein breakdown, and the end product is what's called ketones, and ketones are unfortunately not so benign molecules. Mm-hmm. Yes, and that increase the acidity, and of course they start feeling sick. Even they can end up being in a coma, mental alteration. The most dangerous part of this is when the child was not diagnosed yet, because at times they present with DKA as the first sign of diabetes.
That was my patient, actually, when she was 16 years old, presented in an emergency room with DKA. Family had no clue that she had diabetes, actually. Let's talk about the simple way of, let's say this kid is diagnosed now with diabetes, had DKA, diabetic ketoacidosis, he was in a kind of semi-coma, recovered and going home, and you are preparing the parents, they're going to give the shots, the insulin shots. What do you explain to them? What is the insulin? What do you say? Explaining the insulin, what is insulin, how to give the needles, what to do.
I have a patient who was just recently diagnosed, and we are in the process of managing this overall teaching, education, instructions, completing them, along providing them with their own supplies and teaching them how to use, so that when they are home, they will be able to manage on their own.
Now, obviously, the kid is at home and is going to require the injections, and sometimes it could be that the sugar might be too low, and they have to be aware of signs of symptoms of low blood sugar. What kind of education you give to parents? What do you tell them?
Right. As a part of the teaching process, this is extremely important because we know that one of the side effects of insulin treatment is what we call hypoglycemia, which is low blood sugar. And to recognize the signs and symptoms could be life-saving.
What are the two or three things that important they should know, the parents?
Well, whenever the low blood sugar happens, if you imagine when you are really, really hungry, how you feel is more or less the same kind of feeling, where you feel anything from weakness, sweating, a headache, a blurry vision, even loss of consciousness.
Right.
Can happen. Of course,
confusion is definitely, especially in adults, we see confusion.
Definitely.
Confusion starts first, and then the spouses notice immediately that, oh, that sugar might be low, my spouse is confused. But in children, probably that's the same way.
Right. Yes. Yes. Definitely. And actually, one of the things we tell them, if and when there's any change, the parents may not be able to pinpoint and say, okay, this is low blood sugar, but you are not sure what's going on. The child may be looking like daydreaming. Just be sure to check the blood sugar, because hypoglycemia can
present different ways.
Yes, mimic anything
Right.
and everything.
Let's talk about a little bit of the injections. Now we have pens now, instead of, in the past we had only, obviously they had the syringes, they had to draw the insulin amount, they had to know how much. Now their pens are much easier. Do you give pens to these kids? What do you do?
Yes, definitely. I mean, state-of-the-art process managing this, ideally, is the insulin pump.
Right.
But we don't always have that available, or in rare instances, insurance may not cover, although most of the time they do cover. So we teach them how to use insulin syringes, just in case they don't have the pens.
Emergency.
But when they go home, before they go home with pens, insulin pens.
Let's go another subject. Growth-related problems. I'm sure some kids are referred to you by pediatricians with that growth issue. Let's talk about first the familial growth problem, because that's a benign one, and then we don't have to go into detail, hormonal testing and so on and so forth. Either father or one of the parents are short, and they have been short since childhood on, and they expect their child to be really tall compared to his cousins or classmates. How do you handle that?
Great point, because that does become a perception, but a problem at times, because reassuring is not always very easy. If in the family, as you pointed out, if the parents have always been small, whether you want to call them petite or short, they are, or as a kind of different way of looking at this familial growth issue, they may be late bloomers, which is having later pubertal development than usual, in which case, of course, during that part of the time, the child will be smaller, shorter than the peers.
Right.
You can imagine they will have
parents were
puberty.
that way, you
Yes.
might probably say that, well, you were that way when you were young, now be a little patient possibly.
Yes, exactly, because those two things that we call as normal variant of growth are the most benign condition, harmless condition. If the family is short, we know the children are more likely going to be short, but we also know that environmental factors are quite important. We know sometimes from other countries, when people come here and their children are growing up here or born here, we see quite often that they are taller than their parents. So there may be environmental factors, whether nutrition or infection or other issues.
Let's assume that this is not a familial issue and the child is really small. And what kind of hormonal testings you do then?
Before thinking about hormonal issues, of course, nutrition and psychological condition, the environment should be assessed. Assuming they are not issues, then we do check hormones, anything from thyroid hormone levels to growth hormone levels, or the growth factors, adrenal function, pituitary gland, which is what's called master gland. We checked the function of those glands mainly, to kind of mention a few of them.
Do we have growth hormone injections now? Do we?
Yes, we do have that. Actually, for quite a while that what the change has been that before it was cadaver origin, now we have the synthetic one without having to worry about any other impurity related issues. If the condition taken more broadly, if it is thyroid related, obviously we have thyroid supplement. If it is growth hormone related, yes, we do have that. That's injection on a daily basis. That's a slight inconvenience, but most of the parents are happy to know that if that's the case, that there's something that will help their children.
Dr. Agdere, thank you for coming our program. Hopefully we'll see you in another program.
Well, thank you very much for inviting me.
Now it's time for this week's article. It is about dairy consumption and risk of becoming overweight or obese in women. Dairy products are recommended by dietary guidelines to meet nutritional requirements for protein, calcium, potassium, and vitamins. The association of dairy products consumption and weight gain has been a subject in many studies and in many countries. In Framingham Heart Study, higher total dairy intakes were associated with less weight gain and waist circumference gain over a 9-year period. In Nurses' Health Study, when women who were obese at baseline were excluded, higher intakes of whole milk but not low-fat milk was associated with less weight gain over a 4-year period. In a Spanish study with men and women who were normal at baseline, yogurt intake was associated with lower risk of becoming overweight or obese. And in France, it's a French study among overweight adults, in intakes of dairy products, milk, cheese, and yogurt were associated with less weight gain in those who had higher intakes of total dairy products. Finally, a recent study from Harvard Medical School was done over 18,000 women. They investigated how dairy products intake was associated with change in weight and risk of becoming overweight and obese, initially in normal weight women. After 11-year follow-up, the conclusion was greater intake of high-fat dairy products but not intake of low-fat dairy products were associated with less weight gain. More consumption of high-fat dairy products, regular yogurt, regular cheese, or milk, not low-fat, are important for prevention of weight gain. So eat and give your children your regular yogurt, regular cheese, and your regular milk. Organic if possible, for good protein, calcium, and potassium intake. Good health is precious and priceless. Keep informed. For up-to-date information, visit AAHPO's website, aahpo.org. I'm Dr. Ohan Karatoprak. Until next program, so long.